So hello everyone and welcome to the case 19 of this case discussion series, and today we'll be discussing a very interesting case. So we have here an elderly female who presented with chronic low backache since the past 2 months, and she's a known case of breast carcinoma on treatment. So this is the lumbosacral spine sagittal images, and we can see that on T1 weighted images there is homogeneous altered signal intensity, multiple vertebrae are involved, and also the posterior elements are involved. These are the T2 weighted images SAG. Again, we can see that hypointense altered signal intensity involving the posterior elements. These are the T1 post contrast. There is some cortical buckling that can be seen. Also, the posterior elements are involved and multiple such vertebrae are involved with patchy heterogeneous enhancement. There is collapse of L1 vertebra. These are the T1 post contrast axial images where we can see that there is some paravertebral soft tissue also that is present, and some heterogeneous enhancement that is present along with the involvement of the posterior elements. So this is a report that I had given that there is wedge compression fracture of L1 vertebral body with focal kyphosis. There was post-contrast enhancement of the upper end plate of L1 vertebra with altered signal intensity involving the vertebral body and the posterior elements of L1 on T1 weighted images. There were altered signal intensity showing T1 and T2 hypointense signal suggestive of replacement of the normal marrow fat, involving complete L3 vertebra with its posterior elements and posterior elements of all the lumbar vertebrae and posterior part of the body of the L4 and the L5 vertebrae. There was posterior cortical buckling of the L3 vertebra as well, which was seen on the SAG images as I showed. This is very important because that is how we differentiate osteoporotic fracture from a metastatic fracture, along with heterogeneous post-contrast enhancement of the vertebra, and there was some paravertebral soft tissue also that was present. That is also very important to differentiate an osteoporotic fracture from a metastatic fracture. And there is some heterogeneous patchy contrast enhancement that is seen in multiple lumbar vertebrae. Features were suggestive of a vertebral METs. So basically, the features which were suggestive of a metastatic fracture include a posterior cortical buckling, heterogeneous post-contrast enhancement of the vertebrae, paravertebral soft tissue enhancement which was seen, and there was replacement of the normal marrow fat which was seen as altered signal on T1 as well as on T2 weighted images. So this is a nice table that lists out the differences between an osteoporotic fracture and a metastatic fracture. The signs which favor benignity include a presence of normal fatty marrow within the vertebral bodies, that is hyperintense on T1 as well as on T2 weighted images, absence of any multifocal involvement of the vertebrae, absence of pedicle or posterior element involvement, presence of a fracture line, absence of convex cortical contour or posterior angulated fragment. That cortical buckling is usually present in malignant fractures. Intravertebral fluid or T2 fluid sign which is present in benign fractures. Fragmentation is usually seen in benign fractures. Signs which favor malignancy include absence of normal fatty marrow, as in this case the marrow fat was completely replaced and it was appearing T1 hypointense as well as T2 hypointense. Multifocal involvement which was seen in this particular case. Pedicle involvement was also seen. Absence of a fracture line, convex cortical contour or cortical buckling which is typical of a malignant fracture, or extraosseous soft tissue enhancing component which was seen in this particular case as well. Absence of a fluid sign, T2 fluid sign is absent here, and there is no fragmentation that is seen in malignant fractures. So this is another table that lists out all the checklist that we have to see before reporting, that is whether there is cortical convex posterior border, epidural mass, paraspinal mass, fluid sign present or not, destruction of the cortex is present or not, there is paired bone marrow fat or not.